prepare machine for the use of our patients, how we prepare our machine free of infections, free of germs, and just perfect for the therapy of our patients. So follow me do this. This is dialysis machine and it's an improved product. Right now, this machine is undergoing technical test. You can see that the startup test is in progress. Right now it's on 56%. It has to reach 100%. And the acid concentrate, we have our bloodline, we have the dialyzer. This dialyzer serves as a temporary kidney, and this is where the diffusion and osmosis takes place. This is where the waste is being removed, water and everything. This is also one of consumables. But dialysis cannot take over all the functions of the kidney, like I said. The kidneys helps in several ways. The kidney helps in secretion, they helps in excretion, and they helps in the regulation. The kidneys helps in the secretion of hormones such as erythropoietin, the renin, that helps in the regulation of the blood pressure. The kidneys helps in the removal of waste, and also the kidneys helps in the regulations of electrolytes. But when it comes to dialysis, the dialysis cannot actually do all these works. Dialysis can only, be helpful in the removal of waste, can help in the removal of excess fluid, can actually be helpful in the regulation of potassium, some electrolytes, and that dialysis cannot actually regulate blood pressure. Dialysis cannot secrete hormones. And that is why kidney transplant has overall advantage to dialysis. When it comes to the best renal replacement therapy that can actually take over the functions of the kidneys, it has to go to kidney transplant. Dialysis cannot actually take over the functions of the kidney. Dialysis can only help to do some, but cannot take over all the functions. And this is one of the important things that we use in the preparation or the treatment of dialysis. This is our RO. This is water treatment. And believe me, we work tirelessly on this. We ensure that the water is permeate enough, free of infection, free of germs, in order to prevent this patient from being infected. A patient section is being exposed to about 120 liters of water. So tell me, that is why it is actually important to ensure that we use permeate water for our patient dialysis section. As you can see, these are money. This is the bloodline. Okay, so this machine is almost ready. It's about to start priming. We've already put everything, basically all the consumables needed. The dialyzer, like I said, that's where the osmosis and diffusions takes place. We've put the cobblers, that's what supplies the dialysate. And okay, and you can see from our skin, from our screen, the machine is about to start priming. So this dialyzer, this thing that is attached to the dialyzer, that's the couplers, is what supply the dialysate, and this dialysate is actually what helps in the cleansing of the blood. You understand? Although the dialysate and the blood do not touch each other, it's just the force that is in between them that is attracting the waste away from the blood. So the machine has started priming. You can see machine is priming now. It's priming. The purpose of the priming is to push out the air out of these dialyzers and the bloodline, and also to wash out whatever preservation with it and any chemicals. So that's the purpose of this priming, to ensure that there is no air. You can see, ensure that there is no hair whatsoever. It's pushing out the hair, anything that may be inside it, and it's going through the drain ports. See the ports? That's what it's doing now. That's what the purpose of this priming. Priming is taking out the hair. You can see it's pushing it out. Why this machine is priming, I would like to tell us that it's not everyone that is on dialysis for life. There are some people that may get better after some sections, and these are people that their kidneys might be shut down due to a sudden occurrence, maybe due to excessive bleeding from road traffic accident, due to dehydration. It could be dehydration from stooling. That is why it's actually important for us not to actually aim at abusing flagyl whenever we have diarrhea, but instead focus on replenishing the electrolyte lost and the fluid. And that is why I always encourage people who has diarrhea to focus on taking oral rehydrating solution, that's ORS. So it will be so helpful to the kidneys because a lot of fluid has been taken out, electrolytes. So it's actually better and it's actually good for us to have them replaced. So in a case where somebody is having acute kidney injury due to sudden occurrence, abrupt occurrence, so that person can actually recover after a few sections of dialysis. But when it comes to a chronic kidney injury, I'm sorry to say, but someone has to be on dialysis for life if the person is not actually looking at going for kidney transplant. The sad news about it is that to live a near normal life once kidney injury is chronic, you have to be on 3 sections of dialysis in a week. The question is it sustainable? Is it sustainable? So thank you. You can see this machine is ready. Machine is ready to connect patient. Please stop the blood pump. That's to tell you that this machine is ready. Thank you for staying with me. Bye.